Tex, and welcome to Tex Talks. This is the second part of a two-part video that first started talking about seeing some of the differences between the bipolar diagnosis and the borderline personality disorder, leading into a big discussion of why there's a problem getting the right diagnosis. And it's not a problem, it's several problems, and it depends on the situation. And I'll try to go through each one of those. So, bringing into a little bit of the history of it, if you don't already know, a lot of times certain diagnoses will be stigmatized. You can go online and read all kinds of bad things about all kinds of diagnoses, depending on, who's got something to say about it and what they're doing. One of the things about the bipolar diagnosis is it's become more acceptable, in my opinion, over time, and you see a lot of it and it's being treated, so it's more of a okay diagnosis versus borderline personality disorder, which for a long time, when initially when that was being treated, it was very difficult for therapists and psychiatrists to really come up with a good treatment plan. And there's a lot of history on that because they, were used to diagnosing people who had depression and working with depression or anxiety or even bipolar. And the typical treatment plans and things and ways they were treating those individuals with those diagnoses wasn't working well with people who had a personality disorder, particularly BPD, but also, narcissism, antisocial, all of the others. But the cluster Bs are usually the ones that get, all of the press and all the lights because they are the more extremes, and you tend to see more of those and see them because they're out in public, they're in front of you, they're happening, they're going on. So a lot of times several things would happen. One is that even the discussion between therapists and mental health professionals, whether or not you should tell someone their diagnosis, which, I take the stand of my professional ethics, is you have a right to choose what kind of treatment you want and to understand your treatment. I don't just treat you for what I think you have and refuse to tell you what you have, because you should have, free will. You should have the right to choose your treatment plan, which means being upfront with you. Uh, the therapist, some will argue that, well, if you tell someone they have a diagnosis, like borderline personality disorder, that individual will then not come back to treatment because they'll be so upset at you for that diagnosis, they'll refuse to get treatment. Bullshit. Yes, there are some. I totally get that. Those are also some people that no matter what you tell them, if they get upset at you, they won't come back. And that means that you've now engaged in kiss ass therapy, and I don't believe in that either. I believe in being honest, upfront, including you, being collaborative, having you, talk about your treatment options, explaining to them over time how they're changing and shifting, letting you know your progress. And it's not my job just to make you happy and cater to you. It's my job to do what you hired me for, which is to administer treatment therapy to help you achieve the goals that you want in the therapy session. And those are different for everybody. Some people may want to concentrate more on one thing than the other, and that's all well and good. That's part of being collaborative and having you, do that. To do that, I have to be honest with you up front about what I see and what I think. And if I'm not sure, I'll tell you I'm not sure. If I tell you I'm trying to pull it apart and figure out, is this trauma, or is this BPD, or is this borderline only, or borderline with anxiety? What's going on here? What other things could be happening? What other conditions could you have? I try to be very open about that. I have, in the past run across a lot of therapists who will say no. There's even people out there who will totally flat out deny that a diagnosis exists, that there's no such thing as this. And I'm not going to name names. I'm not going to get into it with them. You know, they're making a living. People are buying their product. Hey, go for it. My thing is if you come to me, I want to be honest with you and upfront. Uh, Sometimes therapists will not tell you a diagnosis because of what we call countertransference. This is me being totally upfront with you again. Some professionals will, because of their own fears, their own beliefs, project them onto a client and then treat accordingly. And I have a discussion about that. And if not, because I do make those mistakes and think I've put that video out and I haven't, I will go into the whole idea of letting your countertransference, your feelings as the treating provider, you let them dictate your therapy, which is wrong. They should inform your therapy, but not control it. Knowing that you have those feelings and accepting them. That's why therapists have consultation groups, support groups. We do lots of things to understand ourselves. And by understanding ourselves, we're better able to help you. So being able to come to that and go, okay, I have a fear of that. I should not let that interfere with my telling you what's going on. And it's also my job to seek more informed professional training. A lot of times a newer therapist may not have training in this yet. There's so many different things. And this again comes within your own, ethics guidelines of telling somebody this, I know how to treat these things. These are my specialties, or these are my areas of treatment. These are things I haven't been trained on, or I've only had basic training and I don't specialize in. And maybe it'd be better for you to see a therapist who specializes in this thing. Sometimes I totally admit I have clients who will come to me. I'm not a specialist in a certain area like OCD. I have CBT training, cognitive behavior therapy, and I can work with you. And if your OCD is more of the moderate, severe, or severe, I'm going to be upfront with you and go, I can only take this horse so far. You're going to have to get someone else to help pull it the rest of the way because what's going on. Now, with today's lack of therapists and long waiting lines, I'd rather you get some help until that opening opens up over there, and then you can go over there and get the rest of your help. And I'll help you get through to that stage. But if it's out of my sphere of understanding, I will tell you that up front. No, I've never treated this. No, I don't understand that. No, you know, there are certain areas that you need to see specialists in. Eating disorders, OCD, that's severe. Um, Trauma, one of them. I've been trained in trauma, so I tell people, yes, I can work with trauma. So for some, they just don't know yet. And for some of the people, like I said, they're scared. Some people, and here's the interesting one, want to pick their own diagnosis. Now, this isn't me trying to, I can't help it. This isn't me trying to be too hard on people, but, be careful of Dr. Google, because you can look up on Google and throw some symptoms in and come up with interesting stuff. So you search, and the thing is you have to understand your own bias. If you have a confirmation bias that you already know what you want or know what you don't want, then it's very easy for you to exclude any information that disagrees with what you want and only read what agrees. And you can find somebody somewhere on the internet who will tell you what you want to hear. And if you don't know it, your search engine is geared to do just that. If you look up a lot on a certain topic, your search engine will tune itself to you as an individual. And what you look up and what another person looks up, you may get totally different answers to. So it's almost like your search engine knows you want to be diagnosed with that and will help you find information that lets you be diagnosed with that. Now tell me that isn't a tough one to go through. That's like walking up to a therapist, a social worker, a psychiatrist, and going, "I want to be diagnosed with this, please. Can you please do that?" "Oh, sure. Let me find enough reasons to give you that diagnosis." That happens. Shouldn't. Does. And some diagnoses get in vogue. Literally, some people want to have this. All of my friends at school have this diagnosis. I want that. Or they have this one, but I want a cooler one. Sometimes people are scared to death of a diagnosis. They read that and go, oh my God, that just sounds horrible. I don't want to be that person. I'd rather have bipolar. And the thought pattern for some people is literally down to where their locus of control is. In other words, and again, things I've discussed, your locus of control is your idea of where control lies in your life. And if you have an external locus of control, then everything is the outside world's fault. All blame for everything lies outside of you. You have no control over life, in your opinion. If you're an internal locus of control, then you feel that you act and do and are either responsible for or have some way enacted to bring about events in your life. And you can't have just the icing on the cake unless you're just going to scoop it off the top. In other words, you can't just say, oh, these bad things are not my fault and the good things in my life are my fault. Wait a minute. Because, see, having control internally means also that you brought about the good things in your life. You worked hard for some things. The idea is about balance, internal and external. Some things happen in the world that have nothing to do with you. It rains, the sun shines, nothing to do with you. Internally, though, you make decisions. Keep an umbrella, wear a rain jacket, sunshades. So parts go both ways. If you tend to put all your eggs in one basket, though, it will change your thinking. And to me, wanting to disregard one diagnosis for another often becomes a case of being able to say, and it's not my fault all these things are occurring. Those things that I'm doing, that's not my fault. I have ADHD, therefore you can't blame me for this. I have bipolar, you can't blame me for that. And I always say the minute you know your diagnosis, you start working on it, and then it is affected by you. You do make decisions about seeking treatment, doing the things that will help you cope, learning the coping skills, and you carpe diem, seize the day. You go seize control of what's going on around you, and you start making changes in your life. And some days things will happen that you have no control and really rattle everything. And then you go back into the mode of picking up the pieces and making your life work. So for those people that don't want to say, oh, I need to do therapy, I need to make changes in my life, I need to admit this, find this, work with this, and train on this. That's a lot of work for some people and they don't want it. So it's easier to go, not my fault. So they will avoid certain diagnoses just for that reason. So there you have it. There's lots of reasons why people either want a certain diagnosis, want to ignore a certain diagnosis. As a professional, they want to give certain diagnoses and not others. There are even people who make a living off of telling people, oh, yes, you don't have to have that diagnosis you don't like. Here, you can have this one instead, and we'll do this thing over here. And if they're getting results, great. There are people who are misdiagnosed. I will say something about that. There are people all the time who get misdiagnosed, and that's why I try to explain that diagnoses are often, in many cases, temporary. In other words, I discussed how you may, when you first see, you may get an adjustment disorder until they're able to get all the symptoms from you to go, yes, this definitely is probably this. And it's possible that you have one diagnosis and then you realize, oh, there is another. Like I said, you're treated for depression and then the medication kicks you into a manic phase and so we're probably looking at bipolar now. And in the same way with BPD, it's possible that you come to the therapist, you only tell them, and this is the catch too, some of the information, either through commission or omission, you make errors. You either don't tell them stuff, sometimes deliberately, or you don't want to share that yet. And that's okay. That's why, as a professional, I always tell people, if there's something you don't want to answer, please tell me that. Don't lie. Instead, just go, I don't want to answer that. You know what I'll say? Not a problem. I'll check back with you later, and we'll see if another time works to talk about this, or if this is just one of your don't bring up topics, you'll let me know, and I make a note of it. You do have areas where you can say, I don't want to talk about this thing or this traumatic event or whatever, and I'm okay with that. We'll deal with it later at your pace, at your time. But it's important to let me know because, like I said, how your diagnosis evolves has a lot to do with the information that we have. Okay? So there's a lot going on here. And, one of the reasons why I'm even doing this is because I had listened to someone um, on media talking about their bipolar, and they went down the line describing symptoms that were borderline personality disorder. And my thought pattern is if someone important or famous or in a high position or just someone that that you listen to says I have bipolar, and then they list all these borderline symptoms, in your mind you click, go, oh yes, I've got bipolar. No, I'd rather you research and find out, ask, seek a professional, and get a diagnosis. Because then if you go to your doctor and demand to be treated for bipolar, they might go along with it. And then down the road, you're all angry because your bipolar medication and bipolar treatment did not work on your borderline personality disorder. No, it don't usually. It's a whole different kettle of fish. Okay. Working with personalities is vastly different than working with, straight up just depression or anxiety or even bipolar. You need to know that. You need to work with it. So, and it's up to you to go out and look at what you've been diagnosed with, think about it, research it, read. Don't trust just one source, because like I said, you can find someone to agree with you no matter what. And the internet is designed to agree with you and make you happy. The internet is your own personal happy space that will agree with you or do anything it can to keep you clicking the button. So you're going to have to go out of that and actually pick up, those things called books with, pages in the middle and read. And you're also going to have to seek professionals out and ask questions. It's up to you. Advocate for yourself. Look out for things. Seek understanding and work on your treatment. I hope you have an awesome day. I hope this explains. If you want to know more, please, by all means, let me know. I will try to add a video on that specific subject or go into more detail. I hope you have a great day.